Let's start again. Ruth
Hello.
and
And there is
Jaclynn.
Jaclynn. Yeah.
Excellent. All right. Ruth, tell us a little bit about yourself. How did you come to be where you are?
Well, wow, that's such a loaded question.
I know.
It is. As I think I started my career many, many years ago in labor and delivery, delivering babies. And I always wanted to end my career in the palliative end of life area. So I think I've covered the circle, and I'm really, really passionate about patient and family-centered care. So this is the perfect place to be. Yeah.
Perfect. And the organization that you're with is Hospice Calgary, but it has another name as well.
Yeah,
That
and I'll actually introduce that in our slides, so that'll be
okay,
helpful for people. Yeah.
perfect. And then Jaclynn.
Hi, I'm Jaclynn. So I'm a registered social worker, and prior to working here at Hospice Calgary, I worked in long-term care, which is really what brought me into an interest in palliative care and working with seniors and advanced illness. So here, my position is a program coordinator for our companion program, which we'll talk about a bit more in the slides. Yeah.
Excellent. All right. So, Ruth, I'm going to tell you, go ahead, share your screen. I
Okay.
am going to turn off my audio and my video, and the stage is yours, ladies.
Okay, and does that can participants see that screen?
I can see it, but let's double check. Anybody
Okay.
having issues?
No, great.
Don't think so. Yeah, we're good.
Okay. So yeah, thanks. This is it's wonderful to be here, and we are very proud of the work we do with the Living with Advanced Illness Center, and hopefully you will learn a lot about our services, and we are very open to any questions as we go along. So I should be able to change to the next slide. There we go. So really, I'd like to introduce, as I mentioned, introduce to you as community members what our services are available at the Living with Advanced Illness Center, and we offer counseling and support, the companion program that Jaclynn will speak to, and then touch base on some of the education that's available to everyone. And I think the biggest way to express what our program does is the sentence that is provided by a book that I'd highly recommend to anyone that is either living with an advanced illness or knows someone or someone close to you. And that sentence comes from Dr. Winemaker, who's a palliative care physician in Ontario, and Dr. Sin Xiao, who are working together, and they published this book called Hope for the Best, Plan for the Rest. And they also have a podcast called The Waiting Room Revolution that is excellent. And this exemplifies exactly what we do, or why we're here, is while your life-changing diagnosis cannot be changed, it's the way you experience that can. So the Living with Advanced Illness Center is under the umbrella of Hospice Calgary. And our promise to our clients is that we promise to journey with people through end of life and grief. We promise to have difficult conversations about death and dying and grief, and hearing people's unique stories and responding with compassion. That is really eloquently put. That is why we are here. And as I mentioned, the Living with Advanced Illness Center is one of 3 centers under Hospice Calgary. So people equate Hospice Calgary to a facility, and that's why we do not call ourselves Hospice Calgary. We are a Living with Advanced Illness Center, which is a grief support services, which we will go through. But also under Hospice Calgary is our Rosedale Hospice, which is a standalone adult cancer hospice. We also have the Children's Grief Center, which offers individual and group counseling and education as well, similar services to what I'll be describing today, but focused on children, on youth, and on parents. So who we serve? The Living with Advanced Illness Center, we serve anyone within the Calgary Health Region and within the outskirts of Calgary that are living with any advanced illness. So that can range from congestive heart failure, you know, a neurodegenerative condition such as muscular MS or ALS. And so any illness that is progressive and life-limiting. And, you know, people that are living with an advanced illness, and there may be some in this that are listening today, are aware that the symptoms can fluctuate. You can have good days and bad days. And there's that uncertainty in predicting how your life is going to be. And so our service focuses on that uncertainty, and we focus on supporting you through the good days and the bad days. And we also recognize that there's a ripple effect on illnesses, so that, you know, this affects your loved ones, it affects your grandchildren, it affects your neighbors, and we recognize that the world as we and our loved ones know changes with the diagnosis. And so our hope with the Living with Advanced Illness Center is that we see you at the early stage so that we can support you through that life journey. Sorry, I'm not savvy here, changing. So when you know, for people with an advanced illness, you're fully aware that when you're given a diagnosis, there are changes to your physical and mental health, your sense of self, your dreams or goals, your job, your career, your business changes, and that financial stability can change. It not only changes you as the individual with the condition, but also the loved ones, because we know that roughly 1 in 4 people that in our province are family caregivers. They're caring for those individuals with an advanced illness. So associated with all those changes can be grief, and we call that anticipatory grief. The feeling we get about what the future holds when we are uncertain. And, you know, there are layers of grief associated with being diagnosed with a life-limiting illness, and this is what the changes are. We also know that grief, people feel quite unsupported with grief, and then there was a national public consultation on grief by the Canadian Grief Alliance back in November of last year, and they asked people about their experience with grief support. And half of them said, you know, we really don't adequately feel we're being supported. Our grief isn't recognized. Our expectations during our grief, be it that anticipatory or bereavement, is that our expectations aren't being met. And people do want a dialogue of grief, on their personal grief. So that's why we're here. So the Living with Advanced Illness Center, we offer counseling and support services from the time of a diagnosis through the illness trajectory onto bereavement. And we also offer, what Jaclynn will spend some time with, a companion program that supports individuals in a different way, in a very community-based way. And we also provide community education so that you to build that community capacity and to empower you with information. So let me introduce you to our counseling services. Oops, I went by one too quickly. I don't know if I can go back. Let me introduce you to our child and family counselor. This is Emily DeLong. So a child and family counselor is a master trained counselor who focuses on the children and also focuses on the parents, so the family as a unit. And so, for example, Emily may see some parents who say, you know, I do not know how to tell my kids that I have an advanced illness that may require palliative care. Or my kids are really acting funny and I don't know if it's because of their age or because of this diagnosis. So Emily teases all that out and she supports the families through an illness. So she may see children alone, and we have specialized play therapy rooms where she may introduce sand therapy, art therapy, drumming, music therapy that allows the children to be in a space that they can express their emotions. And then she can see parents separately, and then she can see family members together and walk them through recognizing, identifying their emotions, and coming to terms with some of those emotions, and finding tools to work optimally during this illness. She also sees young adults, and young adults can sometimes be sandwiched between, going to school and trying to, excel in school, and looking after maybe a loved one, they're being a parent. And I want to share with you an example of a young adult that was sandwiched in that situation, and how counseling supported them. So we have a video of a client that was seen through our service. So I'm going to share this, and hopefully you can hear it and you can see it.
My name is Bill. I'm an incoming second-year nursing student at the University of Calgary. My experience with my mom is her primary caregiver. So my mom was sick with terminal illness back when I was in high school, grade 11 and grade 12. She unfortunately passed away last year, May 2022. It was certainly very difficult to navigate all the different systems. It was very complicated. Where there was this one time in February of 2022 when my mom was released from more of a long-term stay from the hospital. And that week alone, I had about 30 phone calls a day. So I was at school, but I was in a meeting room just taking phone calls back and forth. And that was really, really stressful. I found out about the counseling service through my guidance counselor at my high school. And at the time, I was experiencing a lot of stress logistically, but emotionally, I was also not very supported. Obviously, people my age most of them have not gone through a similar experience. So it was very difficult to find common links to even talk about the experience I had. I really did not know what to expect. Honestly, I was a bit skeptical about it because, again, I've never accessed it in the past. So I was like, you know what, this is pretty much, I'm just grabbing whatever resource I can get. So why not just do it? I think a lot of this work with my counselor was just to unpack the emotions that I had about losing my mom. Especially in the beginning, I had, it's kind of all mixed up together into, grief, yes, but also anger, sadness. There was sense of regret. There's also, like sense of, like I already talked about anger, but like anger at, I don't even know where to direct the anger. So it was really just capturing the last moments I have with my mom, and just kind of enjoying all the little things in life that I had. I think the biggest thing for someone to know before they reach out to a counseling service, if they're feeling nervous, is that counselors are non-judgmental. They will take your life circumstance as is. And the other expectation is that they're not going to fix everything for you. Counselors are here to guide you in your own personal journey, and they are here to empower someone to take charge of their life and to be able to move forward with a significant life change. And I think my counselor did exactly that. And that is exactly what I needed.
Bill is such a remarkable and inspiring individual. So I hope you found that helpful. Emily also sees, she sees extended family members. Like, for example, she'll see grandparents who, may have learned that, their child or grandchild has been diagnosed with an advanced illness, and just facilitate those, identifying your emotions and facilitating those discussions in a place that is very respectful and very comforting is what Emily does well. And then we have an adult counselor who spends most of her time in the community, and her name is Joni Mann. So Joni is an adult counselor, and she as I shared, she is out in the community. She goes to individuals' homes, be it long-term care facilities, a hospital, hospice, or their own home. And she sees adults and couples and family members that have a diagnosis, and she supports them in a place where they are at, so that she gives them space, provides grace, and at the pace of her clients. And one of the things that Joni is very good at is supporting legacy planning. And what legacy planning is, and you may be familiar, and there's lots of information, it's a way of the family, the individual with the advanced illness, the way of them, sharing their emotions. And in some way, it could be through art, it could be through digital stories, it could be through just writing, and having that piece as a legacy for family members. And so I want an example that I have right here is a picture of a tree. And in this particular incident, the individual with the advanced illness helped set up this tree. And then when that individual died at the funeral home, all people that came to the funeral were given a little ink pad, and each of them added a leaf to that tree. And you can see the bird on the tree, and that bird was created by the individual with the advanced illness before they passed away. And then this picture is available for the family, and they have it, in a nice frame at home, and it's a memory for life. And it keeps that memory of their loved ones there in front of them, and it's a beautiful thing. And that's the expertise that Joni has. And we also have another counselor who has a master's in art therapy, or a master's in counseling with a specialization in art therapy. And he uses various art modules or art modalities to support families. In this example, it uses photography, and this is a particular individual that has an advanced illness. He incorporates that photography and also incorporates writing. And so you can see that through a number of sessions, the actual client shared her words with the photograph that Amar had created. And her words are, "I am standing in the presence of mysterious stairs, contemplating. Where will they lead me? As I ask the question, I experience I can't see that, silent moment, resistance, leaving my mind and body, surrendering to what is to come. Is this dance of life I am in the now, witnessing my heart opening to the unknown." So again, supporting her through that uncertainty that's often associated with an advanced illness and that anticipatory grief. I am going to now pass this on to Jaclynn, who's our program coordinator for the companion program, unless there's any specific questions anyone has. So I will, thank you.
Yeah, I think we're good right now. You can keep going.
Great. Thank you, Ruth. Thank you. So I'm going to talk a little bit about our companion program. And if we can go to the next slide, Ruth. The first thing I really want to talk about is social isolation. So a lot of researchers have been looking into social isolation even prior to the pandemic and its impacts on health. And they are finding that it is really associated with an increased risk of a lot of different conditions like dementia, stroke, and cardiovascular disease, and even associated with an increased risk of an early death. And of course, since COVID-19 and the pandemic, we're seeing an increase in social isolation in individuals, and particularly for people who are living with an advanced illness, with any concerns they might have of coming down sick or catching the virus. So in our program, that's one of the main aspects that we're really interested in addressing is that social isolation, so that we can support people living with advanced illness. On the next slide here, we can talk about some of the perceived barriers to social connectedness. So these are some of the reasons why someone living with an advanced illness might become socially isolated. Some of those reasons could include their symptoms like pain or fatigue. It might be difficult for them to be mobile and get around, or their energy level might not be as high. The demands of work or school, a lot of people living with an advanced illness may be working or students, and they find that between doctor's appointments and their symptoms and the demands of school and work and those obligations, that social life is kind of the first thing to fall off the wayside. Another really big barrier is they might fear people noticing their symptoms in public. If they're having maybe shortness of breath, they might not want to go to the gym and work out like they used to, because they might be potentially embarrassed about other people noticing their symptoms. And I found this one interesting, a fear of being found disappointing. So a fear of going out with your friend group, and not being able to be cheerful, or being in a moment of low energy or low mood. And they're worried that if they go out with their friends, then they might be a downer on the group or be found disappointing. And then lastly, just this belief that having this illness could make it impossible for them to connect with others or new people. So these are these perceived barriers, or real barriers for people who are living with an advanced illness, that prevent them from connecting with others in the way that they normally would before their diagnosis. Next here. What I want to talk about is, if you're living with an advanced illness, your hopes might change. And hope isn't always a word that we really associate with advanced illness or palliative care. But in fact, I think it's a really important word to associate with those things, because even though your hope for curing your illness or being completely free of that illness might change, there are still a lot of things to hope for. So some of the things that people hope for might be just as much time as possible. And they find actually that for people who receive really good care that addresses their advanced illness, including this really holistic approach, including their social life and their social isolation and connectedness, it can increase the amount of time that people have prior to passing away from their illness. They might wish for freedom from pain and being comfortable, spending time with loved ones and being socially connected. Getting outside in nature can be a challenge that they might want to be able to enjoy. It's so important to so many people and their mental health. Completing a legacy project, like Ruth was talking about, something to pass down. They might want to attend a special event like someone's wedding or baby shower, or meet a new baby that is on its way. Just having meaningful conversations, just being able to have people they can open up to and really share their innermost thoughts and feelings about what's happening, feeling as well as possible for as long as possible. It's an opportunity sometimes to help others. Quite a few people who are living with an advanced illness could end up working in advocacy or supporting others, peer support regarding that illness. They might want to have a trip that they plan to go on, or have a bucket list of items they want to check off. But ultimately, it's really about being able to enjoy their life and do the things that they love. And that's hope about laughter and hope about joy. So when we talk about joy, I like to think about identifying joy. When you're living with an advanced illness, you can experience these multiple barriers that we've talked about to participating in the activities which do bring you joy. So I would invite everyone here today to really think about what activities bring you joy and what's really important to you, and the ways in which a chronic illness could prevent you from being able to participate in that activity and how that might affect you. So when we're looking at those barriers, we can have a physical barrier, maybe the mobility, transportation, being able to get to the place where the activity is or the people. There can be a psychological barrier where maybe our mood gets in the way of us being able to participate. A social barrier, somebody to do the activity with or to walk with us in that activity. Sometimes there can be a cognitive barrier where an activity that we did before requires like a level of concentration and mental effort that is now very fatiguing. So this quality of life model is something that we really want to think about when we're addressing person-centered care, where we're meeting somebody with an advanced illness and we're thinking about how can we identify what's important to them and address their quality of life. We want to think about all these different factors and how we can potentially avoid the barriers and support them to be able to address all these areas, not just their physical well-being, which the doctors and the nurses will address, but as well their cognitive well-being, spiritual well-being, social well-being, so that we can really be holistic in our person-centered approach. Another thing that's really important to keep in mind is caregivers. So as Ruth was mentioning, 1 in 4 Albertans are family caregivers. And when you're a family caregiver, you can experience most of these exact same barriers to be able to do the activities which you enjoy, because you're also fatigued and you are also socially disconnected or socially isolated. So it's really important to consider what ways we can support caregivers to be able to participate in the activities they enjoy as well. So that's where we come to the companion program. The companion program with the Living with Advanced Illness Center is a program where we have volunteer companions matched with people living in the community with advanced illnesses, and they can help in a variety of ways, such as sitting with someone, providing that social connection, helping somebody to get out and participate in the activities which they enjoy, really optimizing their quality of life by considering all those aspects outside of their physical well-being and their physical health that impact their quality of life. They also, because it's one-on-one, they create these really meaningful relationships. And because they're able to show up in a way where they're really prepared to have some meaningful conversations with people, it gives an opportunity for our clients to be able to really talk about what's going on with them. Something that I do hear a fair bit is people will say that they're not always comfortable opening up or talking about how they feel about their illness with everyone in their life, because people have all their own stress and all their own things that they're going through. But the companion coming in is there just for that. They're prepared, they're ready to talk about these things. They're trained by the Living with Advanced Illness Center to be able to have those conversations and really show up in that way. It also supports the caregiver because they're providing respite for the individual just by staying with them and sitting with them. So the caregiver is able to get out and do their own activities as well. And another important aspect is a little bit of navigation. So the healthcare system can be very complex. And there's a lot to navigate appointments, calling people, being organized. And then there are a lot of great programs in the city, but that can take a lot of navigation as well. So another thing that the companion can do is help with that type of thing, and sign someone up for classes, or help them with their calendar, or help them be organized so that they can access different resources. And again, we're ensuring that we're really being patient-centered, family-centered, person-centered, in that we're coming into this without a bias, but we are actually just focused on that individual and their needs. And the other really important thing about the companion program is that it's a free program, so it has no access barriers. For anyone living with an advanced illness, it's available and accessible. So we have this little infographic about the companion program. How does it work? What is the actual system? What is the whole intake process? And essentially, so if somebody is interested in becoming a client of our program, they'll phone me, and we'll have a chat on the phone about the companion program and see if it would be a good fit for them. And then I'll actually myself go and visit them in their home so that I can go and see the surroundings that the companion will be visiting in, and more importantly, really get to know that client and try and get a sense of what's important to them in a volunteer, and what type of volunteer, or what type of preferences that the volunteer has will be a good match for the client. And then on the other side with the volunteers, I train the volunteers and meet with them in person through our training program, so I get to know them as well. And then ultimately we make a match that we think will be a good fit, and I come back out to the person's home with the volunteer so that we can meet and I can introduce them to the volunteer. That's our meet and greet visit. And then going forward, the companion will generally visit the client about once per week for about 1 to 3 hours, although it just does depend on that particular person and that particular volunteer, how regular those visits are and for how long. And then the other important thing is that we make sure that they have access to our counseling services if they're interested in that. And then we regularly check in with the volunteer and with the client to see if there's any other ways that Living with Advanced Illness Center can support them through their journey with advanced illness. So the companion program, go back. The companion program had a soft launch in the fall of 2022, and we've been slowly growing ever since then. To date, we've had over 90 clients, over 60 volunteers, and over 1,200 hours of engaged companionship, where our companions and our clients have spent time together building those meaningful relationships, addressing that social isolation, and that holistic quality of life model that we're talking about. And this video is actually one of our client companion matches. I'll let them share a little bit about their experience. Let's see, it doesn't look like we have sound. Ruth, are you on mute?
It was Gandhi who said it. It's like find yourself.
Thanks, Ruth.
Hi, my name is Jeremy Bateman, and I've been volunteering with Hospice Calgary with the Living with Advanced Illness Companion Program. I remember hearing a long time ago, I think it was Gandhi who said it. It was like, to find yourself, get lost in the service of others. And that always stuck with me as something that's like very profound and very true. I think for every person, that you get joy in helping others.
So my name is Amy, and your name is?
Well, too,
Yeah, but everybody calls you Pat.
Pat.
So Amy and Pat, and Dad is I moved him from Montreal to live with us.
Yeah.
Right?
Yeah.
And because you've got advanced dementia. So I'm here to help you, right?
Yeah.
We are up at night quite a bit, and Dad needs help with everything. He eats himself, but sometimes needs a bit of help there. So needs everything. It hasn't been hard for me to ask for help because I've seen firsthand how when people don't ask for help, what happens to that person. And as a caregiver, our mental health and our physical health is imperative in order to care for someone else. The companion program provides me with invaluable respite care. It gives me a couple hours a week where I can walk my dog or work in my garden or get some paperwork done or run to the store, knowing that my dad's safe and engaged and happy. And Jeremy comes over. He's so good at taking out activities that you enjoy.
Oh, yeah.
So he'll take out photo albums and talk to you about your life.
Oh, boy.
And he'll play a lot of Uno and Crazy Eights with you because I know you love that, right? And then you talk kind of guy to guy about life.
Oh, boy.
He always does what you like to do.
Okay.
And he's very, very interesting and sincerely enjoys his time with you, I see.
Right.
Yeah.
Yeah.
And I think you really enjoy your time with him.
I do. Everything. The time I've spent with my client really, like I said earlier, just I get so much from it, and the sense of positivity and just an appreciation for how short life can be and the difficulties that people have, and makes me appreciate my own situation and my own family even more. And I learned a lot from my client because he's just a really wise person who lived a really great life. So I enjoy hearing his stories, and I try to emulate the man that he is, actually.
We all need help. It'll make our lives better. It'll make the person that we love, their quality of life better. It's not for forever. It's worth reaching out for. And yeah, I think it's really important to reach out for help. You can decide later if you want it or not. The door's open. It's free. There's nothing to lose.
I wanted to add before moving on that Pat, the client, is a special individual. He was a former cross-country skier, national or provincial downhill skier, and just a remarkable individual. And Jeremy's comment about learning from the clients is so true. And also just to add that most of our volunteers are just incredible individuals, and the training that we do to support ensures that engagement is high quality. Now I will mute.
So on the next here, so that's exactly what I wanted to talk about is our volunteer companions. I quite often hear, and I have a little quote here from one of our volunteers. They said, "I often think I should be paying to get to participate in this program. That's how much I personally get out of it." And I hear that all the time from our volunteer companions. They are so privileged to get to meet with their clients and develop these relationships, and are just an amazing group. The cool thing about our volunteers is they get to show up in a way for the person that our healthcare workers may not have the privilege of being able to do. And that's something with my background in healthcare I've heard before, is how much people would love to be able to have the time to be able to have that one-to-one connection with individuals. But of course, they have so many people that they're taking care of. They have no tasks to complete. So oftentimes, a lot of our clients are home care clients as well, and they love their home care healthcare workers that come in. But when they come in, they're there for a task, for a purpose, and then they have to go on to the next thing. Whereas our volunteers come in with no agenda, they're just there to do whatever the person wants to do. So they have the time and the energy with one focus, their relationship with the client. and connecting with the client in a unique way that's meaningful to them. And that's really rewarding both for the client and for the person to be able to show up for somebody in that way and connect with them in that way one-to-one. Our volunteers love the program. So that's our companion program. Thank you. You just unmute there, Ruth.
Ah, right, yeah. The other component of our Living with Advanced Illness Center, I had mentioned building community capacity and empowering people with information. And we, going back to that hope for the best, plan for the rest, it is about empowering people so that they feel that they can support their loved one as well as possible, or if they are with an advanced illness, that they can live as well as possible. And so a component of that is, again, building that knowledge. And we have several resources available on our website. So, if for example, you have a child who or a grandchild that has a parent with an advanced illness, we even have resources on books on what to reading to that child and sharing their emotions in a very developmentally sensitive way. So we have resources available on our site. There's an example one called Life's Last Chapter. And this book is about what to expect physically, emotionally, spiritually, when you're approaching that end of life and at end of life, because it can be that uncertainty can cause anxiety. So what to expect physically with an individual with respect to, their physical changes, their breathing, their eating. And so just gaining that knowledge is helpful. We also offer team consultation services. Jaclynn and I will go to community, a community and talk about the companion program, or we'll talk about questions about any questions that community members have about managing grief. That's what we're here for. And one other really good available, accessible, and free education is our Dying to Know online monthly education sessions. So these are available for everyone. And you just go to our website, hospicecalgary.ca, and you can register for these events. And so we have one coming up in the fall by Dr. Sonia Jakubek, who's an MRU prof. And she has a very, very special interest in nature and how nature can support us through our emotions and through grief. So she is providing a presentation. Jaclynn, who you've met, is going to provide a presentation on transforming the caregiving experience of dementia. And we have a very special anthropologist who's going to speak about exploring grief through expressive writing. These are available to everyone, and again, free of charge. And they're targeted, not targeted at an academic level, they're targeted for everyone. So really our takeaway is we are here to support individuals and their network, loved ones, to live as optimally as possible through their illness journey. Our counseling, I failed to mention, is offered on a sliding scale. So again, we do not pose financial barriers or transportation barriers. If someone cannot afford counseling, that is not a barrier. If they cannot come to our office, we do come to people's homes. So that's our mandate. And, again, we're under the umbrella of Hospice Calgary, and Hospice Calgary is donor driven. We also get grants. And we thank our community for providing that support so we can provide support back to the community. And that is all Jaclynn and I have to share, and open to any questions you may have.
That was a fantastic presentation. It was also incredibly heavy. So I am going to suggest everybody who has been watching maybe take a deep breath, because you know that there could be a lot of emotions that brought up. So just take a minute, and I have some questions here that are maybe a little bit more nitty gritty, detaily sort of stuff. Okay, Ruth and Jaclynn. General purpose of hospice. How does it differ from the regular medical system? How does it fit in?
That is a good question, and I'd almost also say there's people there's a good question regarding what's the difference between the palliative approach to care and hospice. So the palliative approach to care, if I may, if I hope I'm not like get me back on track if I'm
No,
not.
you're good.
But the
We have questions. We want to know.
The palliative approach to care is very important to understand, and Jaclynn, you can interject at any time. The palliative approach to care is a holistic approach to supporting individuals that have been given a diagnosis that is life-limiting. And life-limiting means that you may have months to live, weeks to live, or you may have years to live. And remember that graph that I shared at the beginning where you go through bumps of that's what illness, that's how illness is. My background is in nursing and so chronic diseases. And so the palliative approach to care, again, is a holistic approach where the biggest goal is quality of life. So what's getting in your way of quality of life? Is it pain? Let's deal with that pain. Is it nausea? Let's deal with that nausea. And so that you can have that quality of life with your loved ones and with yourself. And as Jaclynn shared, you may have a list of things that enhance your quality of life. Let's help you get there so you can achieve it. And hospice is about end of life and also pulling in that quality of life during end of life. And so we will continue to address, those physical things such as your pain management, your eating, making sure you can eat whatever you want, however you want. And it's also pulling in the existential, the spiritual, like what are your values and how can we help you live with those values with your loved ones. And so hospice is the end of life. It's sort of a physical building. It could be home, it could be in the hospital, or it could be at a hospice. But it's that palliative approach to care and moving to that end of life, always with that quality of life at the forefront. In addition with that client and family experience. Does that answer the question?
Yeah, it does. And I guess an additional question along those lines. We are Calgary here, but we do have people that will be watching this and are watching this from different parts of the world or Canada. Is the hospice and palliative program kind of the same across the board, or is your program very unique?
Okay. The Living with Advanced Illness, the counseling program, is that community program,
Mhm.
and the companion program is unique. The companion program is an offshoot, so it's something that's been evolved out of a program called NavCare, and NavCare is a program available. It's very resource focused, and it's a program available through the province of BC, and I think there's other areas.
Okay.
The counseling is very unique in the sense that when you're in the hospital or at home and you've got this condition, and it's very medicalized, right? It's a medicalized condition. And the social workers and the psychosocial support available in acute care is focused on supporting you while you're in acute care And, you may have to apply for certain, government financial supports, and our psychosocial support in acute care does its best to meet the needs of clients emotionally, psychologically, psychosocially, existentially, but they have capacity limits, resource limits. And so we are here to complement that service in the community where we can, as Jaclynn said, we have volunteers that can spend that time. We have counselors that can spend that time. We don't limit the number of counseling sessions to 3. We limit it to when the client feels that they're in a good place.
Okay.
Did I go on another tangent, Heather?
No, you didn't. No, that's good. Let's see. Let's tackle what are the biggest myths about hospice and palliative care? Um, you covered, what it is, what isn't it? What are some of the expectations that you come up against that aren't things that you can do?
Well, I'll give you an example. I was talking to my mother who's 92 years old, and we were talking about, different living situations. And I said, Mom, hospice is and palliative care services are available. And she said, palliative care and hospice is for dying people. And that is, so the palliative care approach needs to be teased out a little bit. The palliative care approach can occur at the time of diagnosis. Because at the time of diagnosis, I talked about empowering people, building capacity. The time of diagnosis, or even before, just people understanding that the palliative care approach is holistic. It's about building your capacity so that you can live that quality of life. So that's one of the myths is it's just about dying people, and that's wrong. It's wrong. Jaclynn, do you have anything more to add about myths?
Yeah, no, I agree about the palliative approach. That's something that we hear a lot, and it can be a really scary word to people to hear that palliative word. So it's really about is when somebody has a serious illness, ensuring that we're right away bringing that quality of life of care into the equation. And there's even been studies done that if we have that really good early palliative care, people live longer. And are healthy for longer. So it's really about not that now your palliative care, it's the end. It's just like the beginning of a different kind of a journey. Yeah.
Have you ever had anybody say that, once they've been given that diagnosis, and some of them are quite long, like it's not an immediate thing, that it changed their lives in how they view it and how they decide to live it?
It's massively life-changing. You bet. I mean, I think for almost anyone, no matter how you view it, and different people have very different views following a life-changing diagnosis like that. But no matter what those differing kind of views are, it's a massive impact for people, and it's a huge life change. And that's part of what we want to address too with our counseling and with our companion program.
Okay. And I've got another one for you, Jaclynn. It takes a lot of I guess emotional energy to be a volunteer. And it takes a lot to work in the field that you work in. If somebody is interested in, looking at volunteering or being a companion or providing that kind of support, what are some of the things that they should think about and look at, and what kind of commitment is involved?
That's a great question. And absolutely, I would say anyone who's interested in volunteering, please reach out. I'd love to talk to you one-on-one even. But I think the important things to consider from the beginning is having good, healthy boundaries and healthy self-care. You know, we all have individual levels and individual needs of what's important to us, how far we can go into a situation or what is difficult for us personally. So if we can examine that and know ourselves going into the situation, I think that that can really help. But the other thing that's super important, not just for our volunteers, but for everyone that works here, is just showing up for each other, you know, and supporting each other. And so we've been working on developing a companion council here where we can meet and engage with our volunteers and they can have that peer support and talking to each other. Because as fulfilling as they do find the volunteering, it absolutely can be heavy emotionally. Being able to support each other is so important.
Wonderful. I think that covers all of our questions. Is there anything that either of you would like to add?
I'll add that, yeah, we're always looking for volunteers, and we have volunteers that are young, like young adults, to volunteers that are retired teachers, social workers, nurses, and you know, you're welcome to contact us, and we would be delightful to introduce you to Jaclynn. My important oh, that's my phone. Excuse me. Apologies. One of my important, I hope one of my takeaways is that, you know, the book I spoke about, Hope for the Best, Plan for the Rest, and the podcast, The Waiting Room Revolution, is it's an excellent for anyone. It doesn't, you know, just to learn about how to navigate the health system and what's important to consider. They speak about 7 keys of navigating a life-changing diagnosis, but that could be relevant to even just you know, just having a child and having a child that enters the health system, just understanding how to navigate the health system, which is a big thing. And yeah, and again, if you have any questions, we are here. And thank you for this opportunity.
Yeah, thank you.
Oh, you're welcome. And again, if anybody's interested, visit your website for those webinars. They are online, they're webinars, so it doesn't matter where you're coming from. You can access that information. And I wish you luck, Jaclynn, on your presentation.
Thank you.
So thank you to everybody.